So I would like to, on behalf of everybody at the Institute for Medical Humanities at Durham University, welcome you to this Global Medical Humanities Roundtable. It's Global Week here at Durham, and all of the university research institutes were invited to think about an event that might engage a global audience or touch on global themes. And we thought we'd absolutely go for the jugular in terms of inviting some of our colleagues and friends and collaborators from across the world to give some insights into how this field of medical and health humanities is unfolding, developing and emerging in different countries and spaces and regions around the globe. So on the webinar today, we have a number of different speakers. We have Jordan McCullough, who is based currently in Ireland. We have Kirsten Ostherr, who has sent a video in because she's, I hope, sound asleep at 3 o'clock in the morning from Rice University. We have Professor Liping Guo from Peking University, who, welcome Liping, we finally look like we can see you in person, which is brilliant. We have Victoria Osei-Bonsu, who is from the University of Ghana and joins us from Ghana. Elizabeth Stevens from University of Queensland, and we're delighted that she hasn't been impeded in joining this call because of a cyclone that's about to hit the coast of Queensland. And Evelyn, Tehrani, and our producer Aria Ray, who are obviously all based in Durham. So without further ado, I'm going to start the proceedings with my slides will move. There we go. To extend the welcome from the Institute for Medical Humanities, where I'm a Professor of Medical Humanities and the Director also of the Discovery Research Platform for Medical Humanities. 2025 marks a 10-year anniversary that's of a special issue of the British Medical Journal's Journal for Medical Humanities that was co-edited by my colleagues William Viney, Felicity Callard and I on the critical medical humanities. And way back in the midst of time, 10 years ago, we outlined 5 things that we thought a critical medical humanities might do or achieve or might seek to develop within the field. These were as follows: that medical humanities might move towards investigating the medical, in its term, across diverse sites and scales, that we might think beyond the clinical encounter and think about health in all sorts of different places and spaces. That we would attend not simply to the context and experience of health and illness, but to their constitution at multiple levels. That we would engage more closely with critical theory, with queer and disability studies, with activist politics and other allied fields, to which we might add critical neurodiversity studies in a big way at the moment. The recognition that the arts, humanities and social sciences are best viewed not in service to or in opposition to the clinical and life sciences, but rather as productively entangled with a biomedical culture. And that critical and medical humanities engages the arts and artists as part of the research process. I don't know if these things seemed novel or distinctive or controversial back in 2015, but I think there's a sense in which they struck a chord with a number of researchers, particularly in the UK, and that a number of these elements of a critical medical humanities have come to be developed and embraced, in some senses contested and further kind of lived, I suppose, in practice over the intervening 10 years. 3 years ago at Durham, we commissioned a report on overcoming barriers to progress in medical humanities, which you can download from our website, and which I think is quite interesting in its capturing a very UK perspective on the field and on what some of the challenges that researchers working in our field face. But again, if we're thinking over that 2015 to 2025 period within the UK, I think it's safe to say, and we'll hear more about this later, that there has been tremendous institutional growth of medical and health humanities in the forms of research centres and clusters and in talk programmes across the country. We have seen over this period a really significant investment in funding, and it's not possible to tell that story without putting Wellcome in a really leading role. There have been, by my calculations, approximately £33 million worth of grants awarded to medical humanities projects over that period. And we've also seen the capacity of medical humanities to make a real difference in the world, to make a difference to clinical practice, but also to, for example, to museological practice, to people and communities across different parts of the UK context. And that measure can be seen, I think, in the growth of what in the UK are called impact case studies submitted as part of the Research Excellence Framework. So what's next then? What might the next sort of 5 to 10 years hold in the UK? My hunch, and these are really personal reflections. I'm not an oracle, and it's certainly not within my power to create all of these things or to not create all of these things. But my strong impression is that we are going to see the continued growth of the field, partly in a research sense in the UK, as really driven by the project. And the projects that I think are going to do some of this work, that have been doing some of this work, are medical humanities led. So where academics working in this field are the kind of leads of these projects. They'll be problem and concept based, so address to, again, as we've seen previously, things like the challenges of waiting across different healthcare spaces, rather than, say, being particularly focused on a single profession or even a single disease. Interdisciplinary, which will come as no surprise, more and more engaged, I think, more and more developed, co-produced in partnership with particularly communities and with health practitioners and people with lived experience. And I think that they'll be ambitious. I don't want to come across as unproblematically valorizing the project as the only or indeed the most prominent vehicle for medical humanities research. And to demonstrate that, I've included a screen grab of a fabulous critical piece on the project written by Will Viney and published on the Polyphony. I think we will see even more, a really interesting set of alliances between medical humanities and critical disability studies. There's some amazing work going on in this area, particularly at Sheffield University and at Bath Spa University, and work that I certainly feel at Durham we're really poised to want to learn much more from. And I think we're going to see continued innovation in terms of what we're thinking of as engaged research, of research that really starts in and with community partnerships, with people with lived experience, with the health professions, and that seeks not only to kind of co-produce research in those contexts, but also to ensure that we're making the most of really innovative forms of research engagement and dissemination. So I've got an image here from the Shame and Medicine Project, which is doing award-winning podcasts, policy briefings, training sessions for the Devon Police, all sorts of things to try and make research in our field really used in the world. And the final point I wanted to make, which I know some other people will touch on, is that I think our field is incredibly well positioned, though perhaps we haven't fully yet realised the capacity to make a contribution to some of these huge and urgent grand challenges. So to thinking through what the AI revolution in health tech is going to mean for health and what our humanities perspectives can bring, thinking through the contribution of the medical humanities to the climate crisis and to broader questions of planetary health. So that's enough from me, and really, as I said, a very kind of personal glimpse of some of the places that this work might go. I want to now pass over to one of my close colleagues, to Jordan McCullough, who's going to be our next speaker as we hand over. Let me just stop sharing my screen. So Jordan is a postdoctoral research fellow at the University of St Gallen. Am I saying that right, Jordan? Gallen? See, pronunciation even of Irish words is a challenge, so I'm going to get it wrong all the way. In Switzerland, so it's not even a Swiss word, it's a Swiss word and not a Irish word. Working on the European Research Council funded Assisted Lab project. He's an associate editor at the Polyphony, which is a site that I hope many of you will be familiar with. It's published by Durham University and supported by Wellcome and has been going since 2018. And Jordan is our first speaker in virtue of his brilliant leadership of a project on the Polyphony, the Multilingual Medical Humanities Project. So Jordan, I'll pass straight over to you.
Thank you so much, Angela, for the introduction, and to the team at IMH for organizing this event and for giving me the opportunity to share a little bit about the work that we're doing at the Polyphony. So the Multilingual Medical Humanities Project is one of our core projects at the Polyphony that we're currently working on, and it's really seeking to challenge the Anglocentrism that's tended to categorize much of the research in the field, both in terms of theoretical approaches, methodological approaches, and research foci as well. And we're seeking to do that by showcasing the work of scholars who are based in or are carrying out research that's relevant to non-Anglophone countries. And really, the premise behind that is to seek to expand what we understand, or the dominant understandings, let's say, of the field by promoting multilingualism, reflecting on what multilingual approaches can bring to research in this area. And particularly at the Polyphony, we're also considering the development of multilingual editorial practices, which allow us to give due attention to the languages in, through, and on which our contributors work. And really, the reason behind this project and the work that we're doing is nicely captured in Stephen Wilson's opening contribution to the project. So this is from his Manifesto for a Multilingual Medical Humanities. And here, Wilson describes the experience of illness, as has been argued elsewhere, as one of border crossing, emerging into culturally unfamiliar or bewildering terrain. But what he picks up particularly is in the absence of reference points, how we might need to develop new codes or vocabularies to enable us to engage with that experience of illness in a different way. Also to be able to translate it across cultural, linguistic boundaries and other boundaries, and equally then to be able to engage meaningfully with the experience of others when it's shared. And by engaging with these questions of language and culture, then we're seeking, as I mentioned earlier, to challenge some of the representational orthodoxies, as Wilson says, in the field as a whole. And some of the contributions that we featured on the project are seeking to do exactly that. So on the slide here, this is just a small selection. We have contributions focused on Germany, Ireland, Finland, and Canada. It's fair to say that the majority of the contributions so far have been from Europe and North America, so predominantly a global north focus. This is something we're actively seeking to address and expand the perspectives that are offered by the project. But in terms of the questions that we've addressed through the series, we've considered questions of language minorities, unequal access to healthcare on the basis of language discrimination, the interaction between language and cultural production to create spaces for medical humanities activism. The challenges of developing medical humanities research in bilingual countries, particularly in the case of Canada, where the Anglophone context is considered to perhaps be more advanced in some respects than the Francophone, and to be developing in different directions, how that produces tensions, productive and otherwise. And also to consider the naming practices in the field and the terminological difficulties that can arise. It's captured in the top left contribution there, focus on Germany. And this is something actually that's featured quite frequently in the contributions across the series. Some countries have decided to graft in medical humanities, the Anglophone term, while others have chosen to develop terms in the local language. Both of these approaches have been problematic in various ways. For the Anglophone term, perhaps it doesn't resonate in ways that might be expected. It seems perhaps a little bit out of place with some of the research that's being carried out in a particular cultural context. Likewise, where a local language term has been adopted, perhaps the resonance of that term because of the fields from which it's developed, or historical implications of a particular word or phrase, can be equally exclusionary. And this has been very interesting to me actually to see how this has been a consistent trend in the work that we've been publishing, as researchers are grappling with how to categorize their research, how to make it the field as expansive as possible and to include as diverse a range of perspectives as we can. And so I think on that basis, then it really highlights the importance of these reflections on multilingualism, multiculturalism, and what it can offer to the field as a whole. And so with that in mind, it just remains really for me to encourage you to connect with us at the Polyphony. Hopefully, as Angela said, you're familiar with the site. If not, the QR code that you have on the screen will take you directly there, and you can browse the various contributions that we have. The web link is also on the top point. We'd also encourage you to engage with us on social media. You have our handles here for Blue Sky and X, and particularly for the Multilingual Medical Humanities Project. If you would be interested in showcasing your research on the Polyphony, please don't hesitate to write to me. You have my personal email address there, and we'd be delighted to discuss how we might diversify this project and beyond the work that we're publishing on the Polyphony as a whole. So thank you very much.
Thank you so much, Jordan. That was fantastic. And I do strongly encourage everyone who might have an idea for publishing both in this series and more broadly in the Polyphony, please to reach out to Jordan and to the rest of the editorial team. Our next speaker, as I said, can't be with us tonight in person for good reason, but it's Kirsten Ostherr from Rice University. Kirsten is the Gladys Louise Fox Professor of English and the founding director of the new Medical Humanities Research Institute at Rice in Houston, Texas. It's one of the few research institutes in the world that is solely dedicated to advancing translational research on human experiences of health and illness. Kirsten shared a pre-recorded video with us, which we will play for you now.
Hello, I'm delighted to have the opportunity to share my thoughts about the question posed by this roundtable on global medical humanities. What next for the humanities in health research around the world? To address the question, I want to highlight some important changes that have occurred over the past 2 decades in healthcare research that underscore why and how I think medical humanities should engage with AI. First, new kinds of experts have been identified, namely patients. Second, new kinds of evidence have emerged based in lived experience, and in particular, the narratives that express what happens outside of clinical settings in day-to-day life. Third, new methods in health research, patients as partners or experts in experience, which emphasizes a collaborative translational feedback loop model of knowledge co-creation. Now, in light of the increasing role of technology in healthcare, one might expect that the changes I have mentioned would also lead to new methods in health technology research and development. Unfortunately, though patient-led design or co-design is acknowledged as important, it is rarely practiced, especially by the largest and most influential tech companies, who instead tend to aggregate and mine patient data rather than partnering with patients as creators and interpreters of their data. This gap raises many new ethical issues, especially as health AI has been rapidly adopted across a range of healthcare settings, particularly through conversational AI like ChatGPT. The central challenge and opportunity that I would therefore like to highlight today is this. As healthcare becomes more and more technological and driven by the logics of data, is it possible that technology itself, and specifically AI, could help to recenter the human dimensions of care? What happens to the narrative of the patient's lived experience in the age of AI? How can clinical algorithms capture and authentically represent the patient's lived experience? Can we identify ways that data-driven algorithms might be trained to handle uncertainty and ambiguity in healthcare? Medical humanities can help answer these questions by bringing insights from narrative interpretation and ethnographic practices, ethics of technology, and critical data studies into dialogue with digital health practices and human-centered design. And I think a key new area of engagement needs to be with bioengineering itself, both software and hardware. Worldwide, AI is being embraced as a tool for expanding existing care networks in high-resource settings and for creating new forms of virtual care in low-resource settings. But from my particular regional viewpoint in the United States, a key shift has taken place that will impact how medical humanities intervenes in health AI. While policy and governance are critically important sites of engagement for the field, here in the US, we have now seen a dramatic shift away from a civil rights-based policy on AI toward an approach that prioritizes business and commercialization. If health AI continues to be developed and deployed without medical humanities intervention, there is a real risk that artificial or synthetic narratives may replace the detailed accounts of lived human experiences that can bring invisible aspects of health and illness to light. We need to ensure that research on health narratives is integrated into the development of narrative-based AI. Medical humanities scholars are ideally positioned to offer guidance on how and when to use synthetic narratives in dialogue with authentic accounts of individual patients' lived experiences. A Lancet Commission on Digital Technologies as New Determinants of Health concluded in 2021 There is a desperate need to reclaim digital technologies for the good of societies. Our future health depends on it. As a field that has a long history of bringing marginalized and silenced voices into healthcare research, Medical Humanities already has the methods to partner with patients and clinicians on inclusive and equitable approaches to health AI. We now need to extend that partnership to engineers. This is the opportunity that I see for the future of the field. Thank you.
Thank you to Kirsten. Fantastic. I'll move straight on then to our third speaker, to Professor Li Pingguo, who is Professor of English and Dean of the School of Health Humanities at Peking University in China. Her research interests include literature and medicine, medical humanities education, and narrative medicine. Over to you, Li Ping. We will. Yes, it's ready to go. Aria
Good
will.
morning and good afternoon in China. First of all, I'm very honored to have this opportunity to share with our colleagues about the medical humanities research trend in China. Now let me share my screen. And this is my title, Humanities in Health Research in China. What's next? I'd like to share with you the trend of humanities in health research in China in the future. Okay, features of the medical humanities research in China. First of all, more and more attention is being paid to the research and understanding of the lived experiences of persons with a certain condition. The second one is the increasing research of doctor-patient conversations. Okay, and the next one is multi and interdisciplinary studies are getting momentum. The next one is research in the medical humanities education. The next one is there's a great demand for translational research of the medical humanities. And actually, I would say this trend reflects a pragmatism in the Chinese genes. Basically, this research, their combined purposes are to use multidisciplinary methods to understand health and illness experiences of persons with a condition and dissect the doctor-patient conversation to understand the power dynamics, persuasion strategies, communication methods, language landscapes of healthcare facilities to foster caring capacity of healthcare professionals and to improve healthcare. In other words, medical schools are hoping to produce human doctors, and related government agencies and hospitals are expecting empirical evidence from medical humanities research to inform policy making that will improve people's experiences and happiness in healthcare. So the possible research are the following. The first kind is qualitative research on storytelling in health. And the purpose of such research is to explore illness narratives in literature and on social media to understand what it means to be normal or healthy or ill, and also to understand the various perceptions of healing. The next kind of research is illness narratives and their impact on public health discourse. This kind of research is trying to analyze personal stories and public narratives to reveal cultural and emotional responses to health and illness. The third kind are course development and teaching innovation in the medical humanities. And the purpose of such research is to design interdisciplinary curricula that integrate the arts, humanities, and the social sciences to enhance understanding of the personal experiences, empathy, and critical thinking. The next trend is arts and humanities intervention in healthcare. And the purpose of this kind of research is to investigate how creative activities, such as prompted writing, can improve treatment adherence. For example, now our team is collaborating with a cardiology department of a hospital in using prompted writing to see if such writing can enhance exercise compliance in people who have heart bypass surgery, because these people are really afraid of exercise. But at the same time, exercise are very important in restoring health. So we're trying to see if we gave them some writing prompt related to exercise and their subsequent experience of writing on these topics can increase their adherence to this prescription of exercise. And the next area of medical humanities research in China is conversation analysis of doctor-patient interaction. And the purpose of such conversation analysis is to study communication patterns in doctor-patient conversations to foster trust, understanding, and better healthcare outcomes. The last area of research in China is the medical communication and interpersonal dynamics in healthcare settings. And the purposes of such study is to investigate the communication between the following people. The first is the communication between healthcare professionals and the public. And actually, we try to understand the level of health literacy and how medical knowledge can be disseminated, or knowledge about health and illness can be disseminated. And the next is peer communication among healthcare professionals in institutional settings, such as communications between doctor and nurses, between nurses and medical and physical therapist, and things like that, in the hospital or in community healthcare center. And such research focuses on the understanding of communication patterns in a broader healthcare system to find ways to bridge the lay professional communication between the lay and the professional divide, and also the interprofessional divide in understanding and communication. So to sum up, basically, most of the medical humanities research in China are like pragmatic based. As I've said earlier, there is a strong demand for translational research based on the evidence that has been reviewed by the medical humanities research. So this is what I would like to share with our international colleagues. Thank you very much.
Thank you so much, Li Ping, and thank you for joining us in person too. Hopefully we'll be able to connect with you in just a little bit. I want to turn now to our fourth speaker. Dr. Victoria Osei-Bonsu is a senior lecturer in English literature at the University of Ghana, and she's also a core member of the Medical and Health Humanities Africa Network. Victoria, welcome, and over to you.
Yes,
Yeah,
thank you.
perfect, thank you.
All right, so I'm presenting on behalf of the Medical and Health Humanities Africa Network. And so I'm not just representing myself, but I'm representing a whole team of medical and health humanities researchers across Africa. I'll just give a quick overview of the network. So the Medical and Health Humanities Network Africa is a network of academics and practitioners and artists, activists across Africa who are interested in health-related issues and in building the MHH across the continent. The network brings together people who are interested in or are already working in the field of the medical health humanities, and it provides spaces for people to showcase their projects, as well as to provide information on what they're doing in relation to medicine and health humanities. We are dedicated to rigorous engagement and commitment, collaboration that draw on interdisciplinary specialization for the best outcomes. And as much as we can manage that, the network is Africa-led, it's Africa-focused, and it's Africa-facing. From its inception, the network has been led by Professor Nolwazi Mkwanazi from the University of Pretoria and Associate Professor Carla Champiros from the University of Cape Town. And also from its inception, the key funding bodies has been the Wellcome Trust, just like Angela mentioned in her presentation. We also have regional representatives across different African regions, and this is to facilitate a broader regional visibility through envisaged operationalization and establishment of other umbrella regional networks. So there has also been the development of the Southern and Eastern Africa Medical Health Humanities with the acronym SEAM. And there has been also the conceptualization of other regional networks like the West Africa Medical Health Humanities with the conceptualization WAM. There are other considerations for other regional networks as well, which would include the Central and the Northern Africa regions, and also an East African sub-regional network that is solely championed by another colleague in that area. There have also been considerations for a possible operationalization along broader linguistic classifications, such as the Anglophone, the Francophone, or the Lusophone classifications, which basically describe how the continent is panned out in terms of language distribution, major language distributions, because of course there are also sections that have Swahili, etc. And we hope to be able to look into these kinds of areas in the future. The network has indeed faced a number of challenges, especially in terms of the resource dependence and uncertainties which threaten firm methodological notions. So how do we develop methodological firmness, and how do we continue to work with the kinds of resources that we can get? Of course, this has also been jeopardized by the recent Trump decisions funding to the US aid, which supports a lot of research in Africa and across the continent. But there's also the challenge of the rise of AI and big tech, which uses algorithm-based problem solving, and which in some ways is jeopardizing the funding of humanities and social science research, especially across Africa, where there is indeed a lot of contention about how AI is used and how it really works for our systems, where very many people would still work with a lot of personal interaction rather than thinking about how AI might work in this dimension. Then there is also the challenge of disciplinary boundaries, rigid policing of disciplinary distinctiveness, and increase in scientocentrism that leads to inadequate interdisciplinary collaborations. So we definitely need a lot more interdisciplinary collaboration. Of course, apart from the challenges related to the linguistic hierarchies that we've inherited from, of course, historical, colonial, histories. We also have the problem of disciplines that are rigidly structured in hierarchical distinctiveness. So there are the sciences that are the sciences, and the humanities and the arts that remain that, and very often it's very difficult to see how these merge or spill over into, or can merge or spill over into each other. And this kind of rigidity in how the sciences remain the sciences, etc., causes a lot of problems with collaborations across the disciplines, especially within the African region. So when you're trying to apply for funding and there are these kinds of spillovers or interdisciplinary, multidisciplinary collaborations, it can cause challenges, especially where one needs to use the language of science to describe what they're doing, where in actual fact there is also the language of humanities and the arts, which may not necessarily follow the science, requirements, the requirements for scientific discourses. And then there is also the lack of institutional support to grow the MHHA. So across the continent, there appears to be quite a bit of institutional grounding for the medical and health humanities research, especially in South Africa. But in other regions, it's very difficult to actually, get the institutional support to grow this kind of research in different institutions. Once again, because of the strict policing of disciplinary distinctiveness. The opportunities and potential that we foresee that the network has within the region, within the African continent, is that fortunately, the continent is very resourceful, has resourceful people with abundant imagination and intellect or intellectual ability, and of course, with ideas to put into collective practice and develop multiple knowledges. And so we do what we can with what we have and try to, make the research work within the distinctiveness of the continent's resources. We also have a lot of young people who are keen to learn, and so it creates a potential for the medical and health humanities to continue to facilitate learning and praxis as it continues to grow across the continent, as we continue to gain interest amongst young researchers. The network is also resourced with people who are willing to demand and work for change that impacts health and well-being. And as a result, the network is able to draw on thinkers, activists, and artists who see the links between health, humanities, art, and broader geopolitical landscape to consider issues for instance, people living under all sorts of challenging situations and how this is impacting on their health or even impacting on their ability to access health. We want to acknowledge other key members of the network who include Dr. Chisomo Kalinga, who is a Chancellor's Fellow in Social Anthropology at the University of Birmingham in the UK. Professor Benson Mulemi is a Research Associate at the Center for the Advancement of Scholarship in the University of Pretoria in South Africa, and myself, whom you see. There's also Dr. Noisa Torres, who is a postdoctoral fellow at the Developmental Pathways for Health Research Unit, University of Witwatersrand in Johannesburg. And we also have Dr. Musa Sadok in the Department of History in the University of Dar es Salaam in Tanzania. So as you can see, we continue to have members, these are the key members who in their own work in different parts of the continent reach out to other people, other researchers, other scholars who are interested in or doing research that may in any way connect to the medical and health humanities in their various regions. So this is so far what is happening within the medical and health humanities research in Africa. And thank you very much. We'll be open to hear what else we can add. Thank you.
Thank you so much, Victoria. That was fantastic and wonderful to see all of those languages in your final slide as well. So our final speaker is Dr. Elizabeth Stevens, who is an Associate Professor of Cultural Studies and the Director of the School of Communication in the Arts at the University of Queensland in Australia. She's the founder of the Australasian Health and Medical Humanities Network and the immediate past president of the Cultural Studies Association of Australasia. Over to you, Elizabeth.
Thank you for putting this on, Angela, and for the invitation to join today. And thank you to all of the speakers who have spoken before me. I've learned so much from that, so it's been really inspiring. I'd like to start by acknowledging that I'm speaking tonight from the unceded lands of the Turrbal and Yugara people here in Meanjin, Brisbane. So I'd like to start by paying my respects to elders past and present, and especially to any Aboriginal or Torres Strait Islander colleagues who might be joining us in the room tonight. So as Angela just mentioned, I'm the founder and convener of the Australasian Health and Medical Humanities Network. This is maybe a newer network than some of the ones that we're hearing about tonight, especially than our colleagues in the UK or the US. We were founded in 2021. You might recognise that that's bang in the middle of the Australian lockdowns for the pandemic as well. And indeed, the consolidation of our already nascent networks into a national network was very much inspired by the health crises of the pandemic. So it's come out of that kind of moment. I've put on the slide the link to our website as well, so that anyone who would like to, you can notice on the slide there that you can subscribe yourself if you would like updates from what's going on in the Australian scene. And we have an archive and recordings of all of our events and so on. So if you're interested about the Australian scene, you can have an explore of that and the network and what's available there. What I wanted to do in my time together this evening was, it's a great opportunity for me to share with you all something I have not had the opportunity to share publicly before, and that is to share a snapshot of who is the Australasian Health and Medical Humanities Network, who makes that group up, because I did a survey late last year, and so I can share a snapshot of what is going on in the Australian scene at the moment. So you can see I had 120 responses to people about what they're doing in the health and medical humanities in Australia at the moment. And you can see on this slide that half of the respondents, everyone who responded, is doing some kind of research in the health and medical humanities. Half of the respondents are also teaching undergraduates and or supervising postgraduates in this field. But I want you to notice how high the number of people involved in collaborations in the health and medical humanities is. I think this is partly, we've been hearing from my colleagues who have spoken beforehand, this is partly something that comes out of the discipline. It's a very collaborative discipline, a lot of people working with industry and community groups as well. But in Australia, as I'll mention, this comes particularly out of our scene that's going on in Australia as well. So where do we come from in Australia? The health and medical humanities, according, of course, this isn't everyone, but according to the responses of the survey, we have representatives of 23 universities in Australia and New Zealand. I know that sounds a lot less than, our colleagues in the UK and the US, where I know those numbers are a lot higher, but let me tell you that we only have 39 universities in Australia, and not everyone who is involved in this area would have responded to this survey. So it's a really substantial representation at different levels, from small research nodes of the kind that Angela was talking about through to really large organised structures in those places. And the disciplinary backgrounds represented are a really mixed group as well. And so you can see we have people from, all across. I got rid of anything that was a duplication, but everything from, anatomy to medicine, things that we might expect. Also all across the modern languages, English and gender studies, lots of cultural studies, creative arts, arts and designs, history and philosophy of science. There aren't many disciplines, architecture's in there as well. There aren't many disciplines that aren't covered in that area. I think that there's a reason why there's such a dispersal of this research going on in Australia as well, that comes particularly out of our scene at the moment. The health and medical humanities in Australia is not embedded into medical schools in the way that it is in some other contexts. It's really dispersed across a range of different faculties. But we also have a less unique, but it was more unique until recently, situation in Australia in which we had a government policy come through just last year to formally, in effect, silo the arts and sciences in Australian universities through something called the Jobs Ready Graduate Package and Policy, which changed the fee structure in Australia so that there's a differential fees for university students in Australia now, in which humanities fees are extremely high, and those in more useful sectors that make students ready to go out and get mostly the STEM sectors have much lower fee schedules. That's actually made collaboration across faculties of the arts and sciences institutionally even more difficult than it was. And we've heard about some of the ways in which that's difficult. So what are the kinds of things that we're concerned about as key issues in Australia at the moment? Well, we've heard about a bunch of really interesting issues and problems, AI, disability studies that people are looking at the moment. In the state that I live in Queensland, this happened a couple of weeks ago. You can see the slide on the board there that Queensland has just blocked hormone treatments and so-called puberty blockers for under 18s in Australia at the moment. We know that this is happening in a time that is already difficult for our trans friends and family members. And so that's one of the local issues that people are really concerned about at the moment. And the reason for this is also because it reminds us that when we're talking about the medical humanities, we're talking about medical issues in their larger cultural context. And this is the other cultural context that we're working in Australia. Just a couple of weeks before Queensland blocked hormone treatments for under 18s in the state, at a national level, we also blocked under 16s from using social media platforms. And one of the things that the medical humanities reminds us is that these kinds of things can be connected. And my colleague, Anna Hickey-Moody, with one of her colleagues, wrote a really important article about this, looking at the fact, the impact on trans people of the social media ban in Australia. And so we're looking at this as it is in other countries as well. We're looking at a difficult situation across a range of cultural spaces for trans people, in particular young trans people in Australia. But it's a reminder that these things are connected as well, that what happens in the health space and in the tech space, as we heard with AI too, can be closely connected. But to leave you on a positive note with what's coming up in Australia, we have just had a meeting about this today, so I'm super excited to be able to share this with you. But we have the first compendium volume of Australian work in the health and medical humanities is due out in probably early in 2026. It has an amazing lineup of people involved. It's an edited collection. It has representatives from as many fields as we can squeeze into one volume. And you'll notice, some of you will notice some of the, recognize some of the names on this list here, people like Claire Hooker, who have been involved in the health and medical humanities internationally for a very long time, Sandra Carr, Alison Downer Moore as well. And what's been really exciting for me as well is that we have a really good collection of Indigenous scholars contributing to this volume. And if I'd had more than a couple of minutes, I would have said that one of the really special factors in Australia, as with Victoria as well, is of course we have a really important focus on Indigenous health issues in Australia as well. And so I'm really pleased to see that they will be very well represented in this volume. Thank you very much.
Thank you, Elizabeth, and congratulations. That looks like a really fantastic volume, which I'm sure many will be eager to read. I want to thank again all the presenters who've shared their insights today. This isn't a comprehensive, it's not a thoroughgoing, it's not a complete account of this extraordinarily dynamic field globally, but it does perhaps put us in touch with some important insights and developments from places that we might not be routinely engaged with otherwise. That's really important to us at Durham. We are really keen to learn as much as we can from what's happening globally. And I suppose that's for two very obvious reasons. One, because I think this health is an aspect of human life. It's an aspect of life on the planet. It's something that connects us all, and something the issues that and challenges that have been described of people negotiating illness and also negotiating different health systems to an extent are common concerns no matter where we are. But the medical humanities is also really deeply invested in working with communities, in thinking locally, in thinking about the particular challenges, culturally linguistic, with respect to the provision of resources and inequalities that aren't necessarily homogenous and generalizable across the world. So we need to hold both to the kind of to what is translatable in the broader sense, as well as what is perhaps really important to kind of cling on to in a regional sense. With that in mind, a final speaker briefly this evening, or this it's not evening in the UK, but I feel very drawn into your reality, Elizabeth, is Evelyn Tehrani, who is the Senior Manager Research and Engagement at the Institute, and who's going to share with you a very special project that we are absolutely thrilled to be launching tonight. So over to you, Evie.
So I am delighted today to be able to launch our Medical Humanities Global Interactive Map and Database. This map and associated database aims to help raise the visibility and connectivity of research in the medical and health humanities, capturing the global humanities research institutes, centres and networks that have been emerging across the world over the past 7 decades. It is a freely accessible resource which we will update on an annual basis. In time, we hope that this resource will become invaluable to researchers, students, and anyone wanting to discover more about the health and medical humanities locally and globally. We have collected information about when these units were created so that we can show the exciting growth and global spread of the medical humanities across different countries and regions in the world over time. Our survey identified 10 centres established prior to 1980, which considered themselves to have a medical and health humanities focus. By 2000, this had grown to 16 units. By 2010, it was 26 units. By 2015, it was 37. By 2020, it was 64. And by last year, when the survey was circulated, 98 institutes, centres and networks had been established across the globe. And we realise we have not captured every single network and institute and centre that exists. However, this exciting development highlights the growing recognition and relevance of the medical and health humanities to health research and practice internationally. We are excited to see and continue to capture how the field develops over the coming years and decades. The associated database provides useful information for anyone who is interested in finding out about activities within the field. It captures the locations, sizes, research themes, courses, and seminars offered, leadership, and key partnerships of the different units. We hope that those within and beyond the field of medical and health humanities will find this information helpful, and that the resource will help to create connections across the field, as well as facilitating new partnerships between researchers and with cross-sector funding, health and community partners. We would like to thank our funder, Wellcome, for enabling our research and field development activities, as well as the amazing team that have helped to create the survey, database and map, including Victoria Patton, our Senior Digital Development and Communications Manager, Ifejula Atunwa, our Partnerships and Engagement Student Intern, Joyanne Chan, our Communications Student Intern, and our operations team. And finally, I would like to thank all our partners and contacts from across the globe who took the time to complete our survey last year and provide us with this invaluable information. Once a year, there will be an invitation sent out across the field to update and add new units to the database. In the meantime, if any of you notice a centre or network you know of but is missing from the database, please do ask them to get in contact with us. We are excited to see how the field continues to grow into the future. Thank you.
Thank you so much, Evelyn, and thanks to everyone who was able to join this live, and to anyone who is watching this as a recording wherever you are in the future. It's been really wonderful to connect and to feel this connection across the world, and we look forward to being able to do similar events in the future. Meanwhile, please do share the map, share the resources, connect with each other, submit articles to the Polyphony if you want to reach a wider audience of medical humanities researchers, and go well. Enjoy the weekend in whatever form it's going to arrive for you. Thank you so much, colleagues. Goodbye.